Trauma-informed care to me is meeting somebody where they're at and honoring their whole humanity. And it is having a holistic perspective on the individual in front of you and having the skills and awareness of how does trauma show up in somebody's lived experience? How does trauma show up in somebody's body? How does it show up in their behaviors? So just thinking about how does it impact a person individually, but also how does it impact them in their interpersonal relationships, how they interact at work, in other groups, in their environment. Additionally, trauma-informed care also looks at society and the greater systems in place. So having a good understanding about oppression, thinking about Dr. Kimberly Crenshaw's work on intersectionality, what privileges and what oppressions does the person in front of you, or what are they experiencing? And not only the person sitting across from you, but the therapists themselves should also be very aware of how they may be oppressed and what their privileges are, and know how to navigate that and hold their own stuff when they're dealing with somebody else. So trauma-informed care, you need to have a good education on how trauma impacts the body, how it impacts emotions, how it impacts someone's mindset and their behaviors, to be able to provide appropriate interventions for that. And to be able to provide appropriate intervention, you need to understand what appropriate assessment looks like. So trauma-informed care also involves a specific skill set in what does trauma look like within the body and how they experience it, and to understand dissociation. A lot of trauma-informed therapists and clinicians don't have a good understanding of dissociation, and that's very common, especially with people with complex trauma. So being able to define different types of trauma also includes trauma-informed care.